Hi, I'm Dr. Maple. 1st December World's AIDS Day. Hello, young man. How are you?
I'm not good. I've been diagnosed with AIDS. Now I'm going to die very soon.
Who told you that you are going to die?
But I have AIDS.
No, my dear, you have only been diagnosed with HIV. Let me clear you. With medication, an HIV patient lives a normal span of life. HIV is a virus that infects the human body, but when someone with HIV begins to lose a significant amount of immune cells, then only they are diagnosed with AIDS. Early detection of HIV and treatment plays an important role in slowing the progression to AIDS.
How will I know if I progress to AIDS or not?
You should know that there are 3 main stages of HIV infection. Acute HIV infection stage, flu and fever-like symptoms are experienced. Clinical latency stage, this stage remains asymptomatic. AIDS, this is the last stage of HIV infection. When the patient becomes vulnerable to opportunistic infections, it can be determined if your CD4 cells fall below 200 cells per cubic millimeter of blood.
How society will accept me now? What will people think about me?
Society has to accept you as a normal person. This infection isn't a representation of anyone's character attributes. Means of transmissions vary. It can be spread through blood, semen, preseminal fluid, rectal fluids, vaginal fluids, and breast milk. This can be transmitted through used syringes, open wounds, and so on.
I'm married. My wife is expecting. Is there any chances that my child would be positive too?
You should immediately get your wife tested first. The most common HIV test is the antibody screening test. If your wife turns positive, then there are higher chances for your child to receive this infection through perinatal transmission of HIV. Yet it can be prevented through taking HIV medication during pregnancy and childbirth. In some cases, it is also preferable to go for C-section to avoid the transmission.
Will my closed ones be safe with me?
Of course, they will be safe with you. There's nothing to get worried to live with an infected person, as this infection isn't spread through casual body contacts or through sneezing and coughing.
Is there anything I can do to slow the progression towards AIDS?
Yes, you can by following the medicine regime and following the basic diet rules that are eating a diet high in vegetables, fruits, whole grains, and legumes, choosing lean, low-fat sources of protein, limiting sweets, soft drinks, and foods with added sugar.
Are there any vaccinations against HIV?
Testing is underway on experimental vaccines, but no HIV vaccines are approved for use outside of clinical trials. Yet, if HIV is diagnosed, the patient should be immunized against hepatitis B, influenza, pneumonia, tetanus, diphtheria, pertussis, and human papillomavirus.
Thank you, doctor. Your counseling really helped me getting rid of my false conceptions regarding AIDS.
You are welcome, dear. This World's AIDS Day, let's take a pledge to help raising awareness regarding the disease and not feeling hesitant to discuss regarding the transmission with your partner. Everyone can play a role in confronting the HIV widespread by sponsoring AIDS education programs and by accepting AIDS patients in our society. With proper precautions, this disease can be eradicated from the world completely. A contribution to a healthier living by Maple and Zestec.